But in terms of when, in between these major crises that we're dealing with, and you work with communities, you're listening to communities, that investment needs to be there. So yes, thanks for mentioning the tech industry. Please support.
Thank you, Maria. Well, we have quite a few more questions and running out of time.
Okay.
So I want to take this one from someone watching us from Tanzania, sent 6 questions. We're running out of time. I'll ask what I think is the most important from the list because we already addressed some.
Okay.
Could WHO share a detailed report on lessons learned from COVID-19 and their impact on policies?
Oh my gosh, that report would be very, very, very long. I can tell you that during COVID, actually during the crisis part of COVID, we had numerous reviews that were done with us. From those reviews, there are more than 300 recommendations that we've used to develop what we call the HEPR framework, which is the Health Emergency Preparedness Response Resilience Framework, which is taking those lessons and moving forward, and how do we prepare for the next one. I do a lot of presentations these days, and a lot of people want to say, what are the lessons that you learned? And I mean, we learn the same lessons every time that there's an outbreak. And we know each time, what we need to do better. There's lots of reports that are out there. Maybe we can share some links of some things there. There isn't one single report, but we are a learning organization. And I think that's really important to say, because this is something that we have to constantly work on and get better at. And I think it's also important to mention the member states that are discussing the pandemic accord, the pandemic agreement. Like, that's exactly what this is. It's like taking those lessons and saying, next time we are going to do better, and here's how.
Thank you very much, Maria. There are a few questions on preparedness for future pandemics and crises. So I'm going to summarize that and ask you, are countries now better prepared than before
DG
COVID?
answered that question yesterday at the press conference, and the answer is yes and no. I mean, in many ways, we are better prepared because we've all just gone through this. And member states, governments spent a lot of investment in improving surveillance and improving their workforce and looking at cross-sectoral collaboration, all of government, all of society approach, investing in diagnostic capacities, improving infection prevention and control in their hospitals, supporting clinicians in clinical care, improving sequencing. I could go on and on and on. Emergency operations centers, supply chain, research and development. But no, on the other hand, because a lot of those investments are going away. And I think right now, one of the things for me that's so striking is that the world wants to forget this pathogen that is still with us. And I think people want to put COVID in the past as if it's over and pretend, and in many respects pretend it didn't happen because it has been so traumatic. But that is really detrimental to future preparedness. We have to use what we've done, what we've lived through, and those of us who lived through this, because many people died, those of us that experienced this and work with our governments, because some of the leaders in those governments are not the same as they were during the crisis period, and make sure that the investments and the gains that were made are sustained as we go forward. I do think that we have some worry around trust in governments, in science, in leaders, which hampers our ability to go forward. I think the world is a lot more complex in terms of the challenges that we face, infectious disease being only one. We have climate, we have economy, we have wars. And so our work is getting harder. So there are elements of us being better prepared. We have better investments, like the pandemic fund, of looking at sustainable investments in surveillance and in workforce and in diagnostic capacities. But it's very, very hard to maintain because that fiscal space, the political attention has really gone away.
Thank you, Maria. And you rightly said a lot of people want to forget about this painful period of our lives, and rightly so. But there are many that are still suffering. And there's one more question, and I think maybe it's important to take about long COVID. Why isn't there a global initiative supported by the WHO to address and solve long COVID?
There are global initiatives that are out there, but we can always do more. I mean, I think the only answer to that question is we want to be able to do more. We need the resources to be able to do that. It's not an excuse, but we have brought together clinicians. We have monthly webinar series, and you're invited to join those, of trying to share the latest information, bringing patient groups together. There's the development of guidelines that are ongoing. We've been working with countries because we wanted to establish cohort studies in a number of countries around the world, high income and low income, urban, rural, to be able to track individuals and support individuals over time. There's much more we would like to do, but frankly, we don't have the resources to be able to do it. We're doing the best that we can with the resources to maximize every investment that's been made in this, but we would love to be able to do more.
Thank you very much, Maria. And as we're coming to closing this conversation, I do want us to take a moment, maybe if you look back and think back about those 5 years, what are the key moments that you remember of, and maybe what we could have done better?
I mean, I've been a bit in a reflective period right now and phase, given that it's, 5 years ago right now that the first cases were occurring. And there was this massive storm brewing that we didn't know. I think for me, there were such critical moments early on. I recall, learning of the cluster of pneumonia of unknown etiology. I recall vividly how actively we engaged here in headquarters, with our regional office in Wipro, with our country office in China, to gather information. I recall a sense of urgency and intense actions where everyone knew what they needed to do. And I think in those early days, we were extremely eager and hungry to get more information out of China, to learn what was actually happening. We used every system that we had. We immediately set up our incident management team within 24 hours at the 3 levels of the organization. We issued notification to all of our IHR focal points and in countries and focal points. So some agencies also around what we knew around this cluster of pneumonia, what questions we were asking, what lab results were pending. We published a disease outbreak news on the 5th of January. We published our first package of technical guidance on the 9th to the 12th of January 2020, within 2 weeks. And we did that because we adapted the MERS coronavirus. Once we learned it was a coronavirus, actually before that, we brought together our lab teams, we brought together our clinical teams, we convened these teleconferences. And on the lab side, we worked with Charité University and Institut Pasteur, and it was Public Health England at the time, and CDC in Hong Kong, and published the first PCR assay on the 13th of January. And that was used to start developing test kits, which we started shipping to on the African continent by the end of January. I remember intense activity. I remember everyone coming together. I also remember the first press conference I ever did on the 14th of January. And I thought I did one, and I thought I was never going to do another one, because I was asked, and Tarek was with me. I remember I was asked, talk about coronaviruses and what do they do and what are we doing? And I recently went back and reviewed that transcript, which is pretty incredible to hear now, around saying, the human to human transmission, and we wouldn't be surprised and likely to have human to human transmission. But all the guidance that we had issued was already assuming that there was. So those early days are quite fresh. For me, the mission to China, because I was on one of the first missions to China in February 2020, is vivid. So it's very fresh still. But I just recall, and I'm so grateful for the staff here. I'm grateful for my family's support, and I'm grateful for the scientific community coming together, because it was incredibly difficult for everyone. But sorry, that was really long-winded answer there. But there's a lot that I recall. And I think for us here at WHO and for the people that we work with in ministries, it's still fresh, and we use this to propel us forward to do better the next time. We could always do better, and everyone could have done better in this pandemic. But with the information that we had at the time is the question. And the other question is, how could we do better to have better information early on? How can we work with member states to make sure that they're doing the right surveillance and that they're transparent with that information? So there's a lot that continues to need to be done for COVID because it's still with us, but also to prepare for that next one.
Thank you very much, Maria. And I'm glad you mentioned as well how much has been done in the first 2 weeks and in the first month, because there have been a lot of misconceptions about the response later throughout the pandemic. But as we're coming finally, I think, to the end of this conversation, what is your message to our viewers before this holiday season? We've had many of those conversations when times were tougher in the pandemic, and when we couldn't really be with each other or celebrate with each other. Seems that at least from COVID-19 outbreak perspective, it's a little bit better. But over to you. What is your message
I mean,
today?
COVID is still with us, but there are many pathogens that are circulating. And so, around this holiday period that is coming up, there's going to be a lot of travel. People are coming together. Do it as safely as possible. Celebrate the moments that you have. Life is precious. And I think people who are out there, they're very smart. What I have been so impressed with during COVID is this desire and this interest in just learning. And I think we've tried our best to try to communicate information to an educated public who want to know, what can I do? How can I take some control? The message is, to have a wonderful holiday, to travel safely, to take a risk-based approach. Make sure, your vaccines are up to date, not just for COVID, but also for flu. For young children, there's a lot of vaccine preventable diseases. Make sure your kids' vaccines are up to date. We will continue to work through the holiday period and to make sure everyone stays safe, but also just be kind to one another. We've seen, I think, during this pandemic, the worst in people, but we've also seen the very best. So our, actions of those early days, it's all documented. We're all online every day. And so those misperceptions or misconceptions of what we've done, you can go back and really see. But our job, and only job, has been to help people and to do our best to keep people safe using the world's best minds and working with individuals, listening to individuals. So I think there's a lot, everybody has a role to play. And even during the holiday period, keep yourself safe, keep your loved ones safe, and have a wonderful holiday.
Thank you very much, Maria. And I do want to thank to our viewers as well for being with us, for participating in the conversation, for trusting us, for also asking us some tough questions at times, including today. And for all of you watching us from Sudan, India, Thailand, the US, the UK, France, Germany, Serbia, Canada, Zimbabwe, Bangladesh, Sweden, Norway, Mexico, Brazil, Argentina, Japan, Australia, Switzerland, Zambia, Tanzania, Qatar, and many others.
Oh, wonderful.
Thank you very much. I'm joining Maria in wishing you to have great holidays and to be safe until next time we talk to you here.
डर लगता है ऐसे कभी भी कैरेक्टर अभी भी करने जाने से पहले